anybody who's watching this. Welcome to part 3 of my essay questions. So, this week we were given 3 drugs. Ciprofloxacin, erythromycin, I know I am butchering these pronunciations, but I figured I'd try, and acyclovir. Acyclovir. Still trying. So, what are these drugs used in this case? What is their role in inhibiting protein synthesis? So, ciprofloxacin actually inhibits protein synthesis by inhibiting the enzymes that are needed to carry out the process of DNA replication and synthesis. So, basically, by inhibiting the DNA gyrase, one of their major enzymes, ciprofloxacin will actually cause it to be unable to perform the normal role in DNA synthesis, which will then inhibit the entirety of protein synthesis, since they are kind of one and the same, because there's deoxyribonucleic acid and ribonucleic acid, DNA and RNA. Protein synthesis is involved in the making of RNA. So if it inhibits the process of DNA, then subsequently will inhibit the process of RNA synthesis. Now, with erythromycin, again, I'm pretty sure I'm butchering this, but a little bit of a break. So, erythromycin works by blocking the entire pathway, the entire tunnel itself that is used for protein synthesis. Thereby, basically, it attaches itself to the 50S subunit of the protein synthesis chain. So what it is it blocks the entire thing, which again is the easiest way of saying nothing can happen if the whole pathway is blocked. Right? Cool. So lastly, acyclovir works by inhibiting the entire processes of DNA and RNA synthesis altogether. So it kind of works the same as ciprofloxacin, except on a drug sense, they work a little bit differently with what they affect, but in reference to what they inhibit in protein synthesis, they kind of work on the same hand in hand. Now, of all these drugs, out of erythromycin, ciprofloxacin, and acyclovir, which one would be best against a bacteria? Out of all of them, erythromycin would be the most effective against a bacteria. Why, you might be asking? The reason why is because since erythromycin works by attaching itself to the 50S portion of the ribosomes in the RNA chain, it will inhibit any formation of any peptide bonded chain, meaning that any foreign bacteria that could enter through a peptide chain will be blocked by the erythromycin, since it is blocking the entire pathway altogether. Now, do any of these drugs affect the host cells themselves? Though they do work to inhibit protein synthesis, and they are drugs, of course, so they will have their own series of side effects, risks, and everything that comes with taking any form of pill, medication, etc., that does not exactly mean that they will actually have any effects on the host cell. They will inhibit a process altogether, but they will not attack the cells singularly, if that makes any sense. Lastly, we talked about what would work against a bacterial disease. Now, in reference to acyclovir, one of the most prominent viruses that it is used against is the herpes virus, or commonly known as herpes. Now, if you're wondering, well, erythromycin attacks bacteria, why wouldn't it work the same against herpes? Because it is a virus. Erythromycin works better against bacterial diseases, whereas acyclovir will intentionally work against a virus. Hence why the most common one that is used is for herpes. And there you go.